Hi guys, so today's video is going to be on, do I really have to read the entire nursing textbook for my class? And this question comes up a lot, and actually John Hawes and I from nrsng.com just did a podcast on this. If you want to look that up, you can go to nrsng.com/NSS. The NSS stands for Nursing School Struggles, which is a new kind of episode show that we've been doing together. So anyways, do you really need to read the whole textbook? Well, here's my answer, and I say this for a lot of things. It depends. And so what I mean by that is it really depends on the course. And the number one thing that I recommend that students do at the beginning of each semester, when you're in your first lecture and your teacher's lecturing and they're using PowerPoints or they're doing handouts, is ask your teacher what you should focus your time on as far as studying for the exams. So don't just go up to your teacher and say, hey, what's going to be on the exams? Do I have to read the textbook? Don't put it like that, because I don't think that'll go over well. But what I did and what I recommend is you go up to the teacher and you say, hey, what has worked well in the past for previous students as far as studying for the exams? Where did they focus their time on? Did they read the chapters before they came to class? Did they just use the textbook to substitute for additional information? You're basically asking the same thing, like, do you need to read the textbook? But you're saying it in a much better way where the teacher will most likely be more willing to, answer those questions. And so what I personally did, besides, I would ask the teacher up front at the beginning of each semester, like, what should I focus my time on? I'll be honest, I did not read an entire nursing textbook throughout my nursing school. But for some classes, I did read a good amount of the nursing textbook, and for some, I didn't even read it hardly at all. And so what I usually did is I would use the textbook as like supplemental information. When the teacher lectured, I would listen to lecture, and then I would go home and use the textbook to kind of expand my knowledge on maybe things I was unclear on, or get the examples from the book that, help you apply what you just learned. The important thing is that we get out of the mindset of we just need to study to pass the test. Because yes, you need to pass the test to pass nursing school, but you don't want to limit yourself to just the information that's going to be on the test, because as a nurse, you're going to need to know way more than what is just tested on the test. Take your studying seriously. Don't just study for the test, but study to be a good nurse. Study to be a better nurse, to provide more care for your patients. So I hope this answers your guys' question. I guess it doesn't really answer your question because I don't have a black and white answer of yes or no, but it really depends. And, talk with your teachers. They'll be, I'm sure, more than willing to, give you some heads up on, if you should really be focusing on the textbook, and go from there. All right, if you have any questions, leave it in the comments below. Give this video a thumbs up and subscribe to my channel, and I'll see you guys next time. Bye.